Welcome to the CannMed Coffee Talk podcast, where we talk with the leading minds in cannabis science, medicine, cultivation, and safety testing. I am your host, Ben Amirault. I am the marketing manager at Medicinal Genomics and proud member of the team that puts on the CannMed conference. All right, well, I don't have much for updates this episode other than to tell you that our team is working hard on finalizing the details for CannMed 25. We still have some I's to dot and T's to cross before we can make our public announcement, but let's just say keep your schedule clear for mid-June. We're also aiming to add our CannMed 24 presentations to the CannMed archive by the end of the month. We apologize for the delay on that. But we still have 5 years worth of CannMed content in the archive now, so feel free to check out those videos and all the past episodes of the CannMed Coffee Talk podcast at canmedevents.com. And while you're there, make sure to sign up for email alerts so you don't miss any announcements. My guest today is David Aronson. David is a cannabis educator who since 2018 has directly educated more than 5,000 healthcare professionals nationwide on the medical applications of cannabis. He is on the faculty for PESI, one of the nation's largest providers of professional continuing education, and he independently provides seminars for health professionals around the country. I learned during our conversation that David also has post-treatment Lyme disease, which is a condition that causes fatigue, neuropathic pain, brain fog, forgetfulness, and other chronic symptoms that he treats with cannabis. His experience made him curious whether others have found success using cannabis to treat persistent Lyme, and has shared his findings at CannMed 24 as a poster presentation and also with me in the conversation you're about to hear. We covered what is Lyme disease and how does one acquire it, the different stages of Lyme disease, treatments that are available to treat chronic Lyme, how David collected data for the study, and which types of products are effective for chronic Lyme symptoms. Before we get to my conversation with David, I'd like to thank this episode's sponsor, McKinney RSA. McKinney RSA is made up of regulatory science veterans who apply lessons learned in the nicotine space to help cannabis manufacturers better understand the toxicological and societal implications of their product. They do that by identifying base compounds, extracts, flavors, and terpenes, understanding how they interact, and ensuring effectiveness for the intended use. They also provide dosing recommendations and establish guidelines for product consistency. You can learn more at mckinney.rsa.com. Okay, and without any further ado, please enjoy my conversation with David Aronson. Good afternoon, David. Thanks so much for joining me on the podcast.
Thanks for having me. Glad to be here.
All right. Well, I'm excited to talk with you today about using cannabis to potentially treat persistent and post-treatment Lyme disease. And this is a timely topic for me because I actually found a deer tick on my torso a few weeks back. Thankfully, I caught it early and took a prophylactic dose of antibiotics. So I'm hopeful that I prevented an infection, but maybe we can get into that a bit. But nevertheless, Lyme disease has at least been on my mind recently. So I'm happy that I've had a chance to talk with you about it here today and about whether cannabis can be used to treat long-term cases. But before we get into all that, I think it would be helpful to establish the basics of what Lyme disease is. So could you do that for us?
Sure, absolutely. And so when first defining something important to note. So Lyme disease is a bacterial infection. So cannabis is not going to cure Lyme disease at all. I look at it as a symptomatic and palliative treatment for the illness because there's so many symptoms and so many side effects from treatments and stuff like that. That's very helpful in that way. But Lyme is a bacterial infection that is transmitted primarily by ticks. And the ticks deer ticks primarily, although they're found in other types of ticks. There's black-legged ticks in the northern latitudes and in the western part of the country too, like in California. There aren't deer ticks, but they also carry Lyme disease. But they're also finding it in Lone Star ticks and dog ticks and wood ticks. So it can be found in any kind of tick. It's just most commonly in the deer tick because the way the life cycle works, they contracted from mice, actually. So just regular old mice are the reservoir for Lyme. And then the baby ticks pick it up from that. They can give it to deer, but then they get on the deer and they fall off deer, and then they often find us, or they find us before the deer. But like I said, there are other ticks, and they all carry lots of different presents for us. So it's not just Lyme. Having only Lyme disease is often an exception to the rule.
Oh,
And so what I would encourage you to do is just ask for a follow-up test for a full panel of the other stuff, in case if you at all feel unwell in the next few weeks. Because there's about a dozen things that they carry that they can pass on to us, and it's very common for people to have 2 or 3 infections at a time.
oh wow.
And it's a special kind of bacteria. It's a spirochete, much like syphilis. So it's like a little corkscrew, and so it really gets into cells and into tissue, and so it can hide really well from our immune system. We can even hang on to white blood cells themselves, and then not only that, but it can change shape. So they, when you take, if it's been in the body for a long time and well established, there's enough of them when they're exposed to one type of antibiotic, they'll actually change into a different type of bacteria that's not susceptible to that type of antibiotic until it's gone, and then they'll change. But it's wild. It's just a nutty thing. So it's very advanced, and it's hard to treat once it becomes systemic in the body. But if you catch it very early, then just a few rounds of doxycycline is pretty much all it takes for most people. But when it persists, it can persist into, and depending on what you read, 10 to 20% of people can end up have chronic conditions, either from a continuing infection or from damage done by the illness.
So what is sort of like, I guess this is more of a personal question. So what is sort of the timeline from, the initial bite till like you're experiencing symptoms?
There's 3 basic stages. So the initial stage is flu-like symptoms. And so people feel pretty sick right away. So the reason I became so interested in this is I had a really bad case.
Oh.
So when I first had it, I definitely had like a summer flu that didn't go away. And I went and saw the doctor, and she gave me a Lyme test, but she said, I want you to come back in 2 weeks. These are very often wrong. And a couple weeks later, I felt a lot better, and she said it was negative, so I never went back. I really should have gone back. So that's something to be aware of, is that the testing is terrible for Lyme disease in general. It's got a little better, but it's a hard thing to detect in the body. They don't culture it or anything like that. They're looking for antibodies that can be hard to detect.
And so did you ever find a tick or
Oh yeah, I got a scar from it and everything, because what happened to me was I found it the day it bit me, but I didn't have like a tick scoop or a pair of tweezers. So I did what my dad did for me as a kid, which is definitely you're not supposed to do, is I heated a paper clip red hot, and I killed the tick while it was on me. But that just what that does is make it regurgitate everything into you, and so like almost guarantee an infection.
Oh wow.
So that was bad. And I had pieces of it in me. I had to dig it out. It was bad. It was like worst case scenario for that.
Oh wow.
But it lay dormant for many years. Such as subacute, and then I either got bitten again, or it was also at the same time as a major life stressor, and then I had major neurological symptoms after that.
Oh, so the symptoms you experienced was well after that initial.
So I had that, and then I had this like weird back pain for somebody in their 20s for many years. And then, like I said, a major life stressor, loss in the family, and all of a sudden I started going numb from my feet up.
Oh wow.
And then having all sorts of weird, like getting lost on the way home from work, and all sorts of really unpleasant things, lots of pain. And it took a long time to get the right diagnosis.
Wow. Wow.
Yeah.
Wow. So I think we sort of touched on it there, like
Yeah.
the different stages, right?
Yeah,
So,
sorry. Yeah, so there's a second stage is when it becomes kind of more disseminated in the body, where and it starts like joint pain and stuff like that. And then the third stage is in the nervous system. And that's when it becomes much harder to treat because the typical courses of antibiotics generally aren't effective. Usually IV antibiotics are needed.
so prior to that sort of last stage, like a course of antibiotics
Yeah, but
clear it
might
up.
need to be for a long time. And if
Mm.
there are multiple infections that have gotten out there, then you might need multiple types of antibiotics. The treatment side, like getting the diagnosis is one thing, but then the treatment side of things is a whole other kind of mess, honestly, because there's no established protocol for these multiple infections. And so everybody's got their own way of doing it. Everybody thinks they're right. And
Mm.
they're probably right for some people and not for others. And sort of it gets to be a tricky thing. And a lot of it's not covered by insurance and it gets really messy.
And so is it also an issue too? Like you could get rid of the bacteria, but there's lasting effects.
Yes, absolutely. So that's where I'm at this point in my life too, where I've got peripheral neuropathy now from it. I have an immune deficiency. I definitely don't have Lyme disease anymore. But I have a lot of symptoms of without a better explanation might start to look like MS.
Wow.
But as long as I take good care of myself, I'm fine.
So what you're telling me is I should call my doctor and get more antibiotics.
Yeah, if you at all feel unwell in the next couple of weeks, yeah, that's what I would do.
All right. So we did. All right. So that was great. I think we touched on how people acquire it, what the
Mhm.
different stages are. We briefly touched about different treatments. Now, is that
Yeah.
a rabbit hole that we can go down,
It's a
or?
bit of a rabbit hole. What I would suggest when if people get Lyme disease and the initial treatment isn't enough, then a great thing to do is there's a few resources. One is to look up your local Lyme, especially if you're in a major urban area or a largely populated state, there's going to be Lyme disease support groups. You contact them, you say, I'm really sick, my initial treatment's not working. I'm looking for names of doctors who specialize in treating Lyme because it really is a specialty. It's called Lyme literate, is a term to use. I'm looking for a Lyme literate physician. There's another organization called ILADS. It's called International Lyme and Associated Disease Society. They really have established a protocol for this, and that's where your Lyme literate physicians get their training from. You can go to their website and do a search for doctors trained in your area, and find somebody to talk to. Most of the time, these people will not be accepting insurance, and so good rule of thumb is to get a good quality rule out if you're sick and you want to know if you truly have Lyme disease or not. You probably expect to spend somewhere around $1,000.
Oh, wow.
Yeah, just to find out if you have it.
Really?
Yeah, well, if you're talking about paying a doctor $200 an hour for their time, and then the testing is generally out of pocket.
And the testing would be from those Lyme literate physicians and not
Well,
necessarily.
they would draw the labs, but there's a few labs that really, because I told you the testing's so bad, the standardized test, there's
Yeah.
labs that are fully accredited and good labs, but they're not insurance covered generally because they do their own assays, and so but they do a good job, and that's usually where these doctors will send the tests.
Okay. Yeah, and I have to imagine too, I mean, at least from my own experience with finding the deer tick, it's tiny. I mean, I think they describe it's like the size of a sesame seed.
Yeah,
So
the nits can be that small. Yep.
so I imagine that, like perhaps in your case too, where you have some of that summer flu or something, or that, that sickness that you just can't kick and, attribute it to, oh, it's a virus or something, but it really could have been.
Oh, yeah. Sometimes people don't know they're a bit. My dad almost died last year. He was in the emergency room in and out for 3 days. They didn't know what was wrong with him, and he kept getting fevers, and his organs were failing. And I showed up and I said, "Have you tested for ticks?" And they went, "What do you do for a living?" I was like, never you mind. And I was right. And then they gave him antibiotics, and he bounced right back.
Wow.
Yeah.
Yeah, and so that didn't develop into some sort of persistent condition?
No, because it was that was a rare kind of case where it hit him hard and fast, and it was anaplasmosis that was really tanking him. Then that happens sometimes. I mean, he's old. He's 80, and yeah, sometimes that happens. It was
All right.
fevers of like 104.
Oh wow. Yeah, that's up there.
Yep.
So your study looked particularly at persistent and post-treatment Lyme disease.
Well, yeah. So we called it that because in the from our so a couple things. One is I didn't want to allude to the fact that one should treat acute,
Right.
like an acute case with just cannabis. So, but also in the data set, these are people that are filling out a form saying I have Lyme disease. So I don't know what stage they're at. But so that's seemed like a large enough grouping that it's kind of safe to assume that they're either treating persistent cases or post-treatment. But there's no reason that some of them couldn't have been acute, but it's just unlikely if they're just in that short treatment window of 2 weeks on doxycycline that they would enter this world of treating it with cannabis, right?
Yeah, right.
The symptoms that we're tracking, like anxiety, inflammatory pain, sleep, those kinds of things are common in the later stages of Lyme. And again, if you're treating it with cannabis, you've probably already been through the standard round. Those are assumptions, but we can't interview these patients. So we're really just looking at, they say they have Lyme and they're treating X symptom, and the tool helps them rate it on different scales. So what's interesting though, is as ubiquitous as Lyme is, as much as cannabis is being looked at, nobody had ever looked at these two together before. And which is really surprising, because if you do just a simple Google search, there's a lot where every dispensary is telling you should treat your Lyme disease with cannabis, and lots of doctors' websites have blog posts about using cannabis to help with Lyme disease, and lots of Lyme blogs and Lyme informational websites tell you CBD and cannabis are good symptomatic treatments, but absolutely nobody has done any academic or formal look at it until now, which is really weird. And we're doing a retrospective sort of naturalistic study, and we're continuing to examine more symptoms and kind of parse out the data, because it really is effective, and it's interesting that it affects people. So the things that Lyme disease is often a root cause of things like rheumatoid, MS, ALS. It can be mistaken for Parkinson's, for lupus, fibromyalgia. These are all things people commonly use cannabis to treat.
Right.
And they're not always caused by Lyme, but Lyme is one of the potential causes of these syndromes. And so that was very interesting to me too. And so what we found though is that people who use it for inflammatory pain, if they have Lyme, respond differently than people who are using it for inflammatory pain who don't have Lyme. Same thing with anxiety.
How so?
So higher THC formulations were found more relieving for anxiety than mixed cannabinoid ratios in people with Lyme. Whereas when we look at overall on the other end, it's usually the other way around, like a 1-to-1 or a higher CBD ratio formula will be better.
Better for Lyme?
For anxiety.
I see. So the THC is more helpful for Lyme.
Because it's better at relieving inflammation, right?
Got it.
In a sense. And so it's interesting. There's a lot. I mean, when we talk about the data, there's a lot I can say about that. It's pretty interesting.
Yeah, let's talk about that. I mean, first of all, where are you getting this data? Like
yes.
Where's it coming from?
There's a great app and website called Strainprint, strainprint.ca. It's a Canadian company, but they also track a fair amount of American products as well. So it's a really great use tracking tool. I suggest to people regardless, because it's helpful, because you might say you use and you find, oh, my pain's really relieved, but it also then will ask you, are you feeling tired? Are you feeling a little irritable or upset stomach? So it helps you note side effects as well. and help dial in. So kind of help dial in your dosing that way. But it asks people to identify their disease or diagnosis, and then it'll give a list of symptoms commonly associated with those, but then you can also choose your own. It tracks up to like 70 different symptoms. That's a lot. And then you rate it how you're feeling on a scale of 1 to 10 before. You put in what you took, and then rate after. And so he's got, for if you're in Canada, for example, all the products in dispensaries are loaded into that app. So it tracks all the testing data and stuff like that. So it's also useful for producers and looking and studies to say, what cannabinoid ratio might be good for this ailment and that sort of thing. So that's it's interesting that way. So we're able to track a lot of different ratios of products that people used. And in this one, we were.
And now, is that down to like the batch level too?
Yeah.
Wow.
Yeah. If it's a company that's regularly submitting their stuff, yeah.
That's awesome.
Yeah, and so it's useful in so many ways. It's really cool.
Right.
So we looked at a combined of inhaled and edible products. So we kind of put it all in one, but it would be interesting to parse that out in the future. And we looked at a range of cannabinoid ratios of including THC only, CBD only, and then naturalistic ratios. So you might, in the data, you might see like a 25 to 1. That's a very high THC cannabis, but it's still a naturalistic ratio. So it's got some measurable amount of THC or CBD and other cannabinoids in there. But we're really just looking at THC and CBD as well, and which is something I think is often not enough, but it's what we have more often than not. And going all the 1-to-1 and on the other end of things. And what we found in this data set was there was an overwhelming preference for THC, very, very strong preference, and very high in the THC only. I note that to product availability.
Sure.
What's pushed in dispensaries, there's a higher margin in distillate in some ways sometimes. So, and then the convenience factor there as well. So I think that's part of it. And then that's also primarily what's in edibles, right? They use distillate in edibles as well, because then they can have an even measure of dosage, even though it may not be the best delivery method. So while that was used the most often, not in every case was it the most preferred, but it always scored very high. But when you look at other ones, what often scored equally high and or better with less dosages was naturalistic ratios or a 1-to-1. CBD only often also didn't perform very well in general. Then we also looked at gender differences. What was really fascinating here was so for pain, I want to make sure I get it right. So you take a look at it. We found in anxiety, like I said, THC only performed really high among it performed better for women than it did for men, which was interesting. I'm sorry, than the CBD did. And then it was somewhat reversed for the inflammatory pain, where men found a better result and efficacy from higher CBD than THC, and women found higher THC more efficacious.
Interesting.
Inflammation too, which is, so that doesn't say anything in particular other than it's really important that we continue to examine gender differences, because whenever we do, there are. I believe it's been a long time since I looked at what it was, but there's a study that looked at blood levels, and women will yield higher levels of THC from equal dosages often in their blood. It's just really important that we look at those differences so that we can better understand how to help people. So for example, so if you had somebody with high anxiety, you might not suggest that they use a high THC product, but with this data, you could feel better about that. Or when they're telling you that that's what they're using, you might not say, "Oh, you shouldn't do that."
And sorry to circle back, but I believe you were saying that, a lot of these symptoms are similar to other conditions like fibromyalgia or, inflammation and things like that. But what was effective for, you know, for that versus what's
Right.
effective for Lyme
Right.
was different. So, I mean, if someone is at the stage where it's sort of more persistent Lyme and that may have been undiagnosed before, is that something that they could get tested for to kind of get a better?
Yep.
Yeah.
Absolutely. Yes. Yeah. And so anybody, so have been a therapist for a long time. That's how I that's why I got into the education of this, because I realized as I was sick that I know I had seen so many people that had had this, because there's really strong psychiatric presentations. And so whenever if somebody gets this far along into it, they're going to have anxiety or insomnia. Depression is very, very common in Lyme. In fact, there's a guy out of Columbia, Brian Fallon, who has done studies where he draws a causative link to
Well,
Lyme, which is a pretty daring thing to do. Um, so it's anytime people have a kind of persistent mental health disorder with a um, not clearly diagnosed or a syndrome type illness that's chronic, it's and especially if you live in the Northeast or spend a lot of time there, it's worth checking. Uh,
right.
and that can be a challenge to get people to look at. Though the tide is changing slowly, it is looked at more and more, especially up in this area.
And now, so once people kind of get to this persistent or post-treatment stage, is it then just all about managing symptoms?
Yeah, yeah. So I mean, it's complicated. Some people get a lot better when they take antibiotics, and but there's a way that the illness works, that there's a stage in treatment where and it waxes and wanes, it cycles where it precipitates symptoms, and you feel a lot worse for a while, and then before you feel better.
Hmm.
And the length of time that goes on is different for some people, and a lot of people get really discouraged and don't continue their treatments. And so it really varies. And some people don't get any better. Some people hit a wall and they don't get any better. Or there are certain things they could do that they don't do, like major diet changes and things like that. So it is really, really variable. Is all I can say. It's all very individualized treatment, which is one of the reasons cannabis is so helpful.
Hmm.
So like before I was diagnosed, I would use cannabis for the thing that we would always use cannabis for, to have fun, and relax and unwind and help me sleep. But when I was diagnosed, I was taking, prescriptions for pain. The nerve pain's terribly hard to treat. I was taking prescriptions for sleep and things to help me stay awake. It was just awful.
Wow.
It was really awful. Yeah, because I'd be basically falling asleep during the day and unable to sleep at night. And when I understood that I had Lyme disease, I stopped taking all those things, and I was able to manage all of my symptoms with cannabis. So I was able to get through all that antibiotic treatment. The nausea and it can really cause low mood and all that. I was able to get through all that and manage that really well with using cannabis.
And is that a combination THC CBD?
Yeah, yeah. I mean, I for me it was pretty much high. I used a lot of high CBD flower and a lot of high THC flower. I'm not able to use edibles. I'm one of those people that I could eat a
Yeah.
pound of them and that nothing happens. That is generally the best for people. Although when you have a lot of medications, that's one of the good things about cannabis, is you can use it in a method that's not going to cause dangerous drug interactions by inhaling it. So you bypass the liver. So that's a good advantage. But yeah, it managed pain. It helped me sleep. It can help lower immune inflammation without lowering your immunity, because steroid treatments when you have an infection aren't an option, right? So it really fills in a lot of gaps for people with this kind of chronic illness.
Yeah. No, and that's true for cannabis in general, right? It is very useful for sort of these tough to treat diseases.
Yeah, it's not it's and I do a lot of education for health professionals, and what I always start by saying is it doesn't cure anything, but it's a just a one of the best symptomatic treatments for almost everything
Hmm.
in many ways.
All right. Well, David, winding down here, any sort of closing thoughts or maybe things we didn't
Yeah.
cover with respect to
Well,
Lyme or the data that
I
we
would
want
say
to
look
cover?
for more. Myself and the person David Berg that runs StrainPrint, we're going to be examining more symptoms, and we're looking for academic partners to help publish this stuff in the literature beyond posters at conferences. But I'll be at more conferences with my posters as well.
Excellent.
So I'll be at the Cannabis Clinicians Conference in October in Baltimore, and yeah, so.
Excellent. And no, the strain print database, is that something that's publicly available or?
The database is not publicly available. The app is,
Hmm.
and you can certainly contact David Berg. He loves working with people and sharing the data and finding ways to get it out there. So I
Yeah.
encourage anybody that's interested in looking deeper at the data and finding out if it can help them out to contact David Berg or myself, and or go through the strainprint.ca website. And yeah, it's a great tool. It's one of the largest databases of naturalistic cannabis data. He's got like remember I said nothing had ever been done. So when I asked him, I said, "Do you have any numbers of people diagnosed with Lyme?" Oh, like 5,000, over 5,000. So the N on these were over 5,000.
Yeah.
So he's good. There's like over 2 million data points, and he's like 80,000 something patients. It's pretty impressive.
Yeah. No, that sounds like a great resource. I'd love to talk with them. Love to have them out at CannMed next year.
Oh yeah, yeah, yeah. You should give him a call.
Yeah, I definitely will. And I hope
All
to
right.
see you there too.
Oh yes, I will. I will be there.
All right, David. Again, thanks so much for the time. Definitely put some links in the show notes for people to learn more about your work and the other resources that you shared. And
Yes, yeah. Send me an email. I'll send you some resources.
awesome. And like I said, hope to see you down in CannMed again next year.
All right. Thank you, sir.
All right.
Bye.